Good evening and welcome to another episode of ThePrint's Virus Decode. I am Mohana Basu, and on Virus Decode, we get experts from across the country to address some of your questions around COVID and the pandemic. India logged about 2.3 lakh COVID cases today, taking the active cases in the country to over 17 lakh. Now, while over 68.5% of the country is now fully vaccinated, children under the age of 15 are still not eligible for the vaccine. So, how does COVID affect children? What to do if your child tests positive? These are some of the things that we hope to address through the session today. On the panel today, we have Dr. Sanjeev Bagai, Chairman of Nephron Clinic in New Delhi. And we also have Dr. Krishan Chugh, Principal Director and HOD of Paediatrics at Fortis Gurgaon. Along with that, we have Abantika Ghosh, who tracks health stories for ThePrint. Thank you once again for joining us. Before I take some of the questions from our viewers, I'll ask you, Dr. Bagai, to start with a very basic question. That is, how worried should parents be about being unable to vaccinate their children yet?
Good evening, everyone. So I think you have to understand what the parameters, at least in the Indian scenario diaspora, are. So the pediatric population of 0 to 18 is approximately 40 to 45% of the Indian population. So that's a sizable chunk of about 45 to 50 crores out of 138 to 139 crores. Children also are liable to get infected. They can carry the same viral load as adults. They can transmit the same as adults as far as SARS-CoV-2 is concerned. There is no difference. There's multiple international data and studies done on this. And so far, they have been completely protected during the lockdowns and the restrictions and absence of school and college. And now suddenly they have been exposed to a huge environment in which we've got wave after wave of 5 different significant variants which have come and hit the world. So they are vulnerable, they are liable. Children also have a lot of comorbidities. Normally, people associate comorbidities only to adults, which is not true. In fact, a single most outstanding comorbidity which increases the risk more than 100% is obesity. And we know that childhood obesity is a huge issue in children, especially the adolescent children. Asthma is supposed to increase the risk of COVID infections and indeed death 6-fold more. And in this present wave of Omicron, children are 6 times more predisposed to get infected and get admitted. What we have seen in the world, in US and in most parts of EU, is quite different than what we have been seeing so far, at least in the pediatric age group in India. The world has been stumped. They have been overwhelmed by more than 200 to 300% increase in pediatric admissions. Luckily, so far, we've not seen the same in India. It doesn't mean that the same cannot happen in India. Therefore, to protect the children, it's extremely important. Both the mRNA vaccines, which have been given internationally, mainly the Pfizer more than Moderna, have shown an efficacy of more than 92 to 94% in the children. There have been from 15 to 18, of course, it has been allowed internationally. From 11 to 15, that is also being sanctioned, and 5 to 11 is now being rolled out in a lot of countries. As far as India is concerned, Covaxin has been approved. The trial results have been extremely good, matching the same results as far as the adult population is concerned. And surprisingly, the efficacy to prevent death and critical care admissions in ICU in the children population is close to 98 to 99%. So it's a huge success in children. And I think pediatric vaccinations in children must be focused on very aggressively in India.
Right. And, that is actually one of the things that parents are eagerly waiting for, because COVID has disrupted children's lives in a way that has not happened before. So, coming to you, Dr. Chugh, just taking this question forward, how do you think the pandemic is affecting children's health in general? I mean, I suppose we now actually have 2-year-olds who have not been exposed as much to the outside world at a time when, their immune systems are taking shape?
Yes, I think it's all related to biology as well as other issues, not just academics, not just exposure the way you are describing. It's much more than that. There are various dimensions to it. Let's start with, let's say, the physical thing. As you said, these children have not been exposed to, let's say, other colleagues and other peers of their age group. So normally in the first 2-3 years of life, when they're exposed this way, they get infections, minor infections from each other. That boosts up their immunity in general also, and to those specific viruses, mainly viruses, and of course other bacteria and fungi and so on, other pathogens also. So once they are not exposed, they've been in a kind of cocoon, and now that they're being exposed, we don't know. In the beginning of winters, when same thing happened in the Western countries, there was a big explosion of RSV bronchiolitis in those children, and there were a lot of admissions. But since they are far better equipped and far more advanced in healthcare, they were able to just, with some difficulty, but they were able to cope up. We don't know if some similar things happen to us, how our healthcare system will cope up with this. Then the next point is what is happening to their development, mental development. That is probably the single most important thing that we all should be focusing on. These young children, if they do not meet each other, if they do not interact with, except the first few family members, they are not interacting with anybody else physically. What is it leading them to? Do they recognize their school as a school building? Do they recognize their relatives as somebody who they are supposed to say namaste and a peripona or something like that? Nothing. It's all virtual, and that is not what we want from them at all. So neurodevelopment and this mental development is a big issue. Then the slightly older children, especially adolescents, they have a lot of neuropsychiatric problems. Many have anxieties, such anxieties and such depressions that they are seeking healthcare, or let's say specialized care from the psychiatrists and the psychologists, and many are not seeking, they should be seeking. So all these issues are very important, and probably the earlier these children come into natural life, the better it is.
Right. We will talk more about, what is the way forward for children, considering that we're still not seeing the pandemic quite come to an end. But before that, Abantika, we did hear, there are media reports today of a 15-year-old in Maharashtra having died after a few days after getting the vaccine. So should parents be worried about reports like this? What are the authorities saying on this incident?
First of all, actually, BMC has said that it had got nothing to do with vaccination. And the girl died. In fact, the girl's family has spoken to newspapers there, saying that she complained of pain in her chest. They gave her soda and all, thinking it's acidity, and then she passed away because of a cardiac arrest. So while it's very strange that a 15-year-old had a cardiac arrest, but I was also looking at the handle from which this news was first shared. It does seem that this particular doctor is an anti-vaxxer, and BMC is in its tweet. BMC is actually saying that we will take legal action against this. See, I think, and that all of us have sort of learned through this pandemic, that it takes all kinds. Take somebody like Djokovic. It's like there are anti-vaxxers everywhere, and one just needs to sort of decide what to do and take a rational view of things without getting carried away by such reports. Also, I think for us, for the media, when we are reporting these things like we here always do, it is very important when you are sort of reporting something that can be alarming, that can have grave consequences for a still nascent vaccination program in 15 to 18-year-olds. I think it is very important that we also sort of, instead of rushing into a story, wait for reactions, try and talk to as many sides as possible, because these sorts of things, see, one retraction or one tweet from BMC is probably not enough, because as we have seen, the power of WhatsApp, this gets forwarded, and that's the narrative that starts building. So I think all of us need to be a little more cautious about these kinds of things right now.
Right, absolutely. So overall, I mean, we have seen data coming in from a lot of countries, and the vaccination drive has been widely successful in India as well. So it really needs to be seen that vaccines do save lives, and it's best not to fall for misinformation regarding vaccines. My next question to you.
It's important to know who to take advice from. You can learn tennis from Djokovic. Don't take medical advice from him.
Right, absolutely right. All right. So, Dr. Bagai, coming back to you, we hear a lot about, COVID being mild in children. But at the same time, like you pointed out, there are instances of COVID turning severe. So what are the signs and symptoms that a parent should look out for when, to sort of accelerate or to seek immediate help from a doctor when the child is COVID?
Sure. So I think children should be treated and be examined and reviewed by qualified pediatricians. That's the first most important point. Very often a primary care physician or an adult physician, not only in India but worldwide, would very easily miss very subtle signs which pediatricians' eye has been trained over decades to pick up. So really the thing is as early diagnosis. Children are a hub of host of infections. So you have to differentiate between a suspected SARS-CoV-2 versus a host of other infections. It could be influenza, it could be Coxsackie, it could be adenovirus, host of a respiratory syncytial virus, and so on. The important point here to understand is that children are 49.5% of the time asymptomatic carriers. That means you may not have any external manifestation whatsoever, not even a cold, forget a cough or fever. So you have to see a very subtle pattern of feeding, of how the child is behaving, the sleep pattern, the food intake, and so on. And of course, presentations of the skin. Skin is the largest organ in a child's body and very often never examined. The other point which is important in children is that if you see the worldwide data, in US alone, and I think India needs to pick up the socks to gather pediatric data, not only in vaccinations which have started, but otherwise as far as COVID is concerned. In US alone, and this is data of end of last month, 8 million children have been infected with COVID. 8 million children. And there have been worldwide studies even to show a mortality rate going up to 0.5%. And 7.5% of these children have been ventilated in tertiary care hospitals. So children effects, coming to your question now, is that what we call as a multi-organ involvement, what we call as multi-inflammatory syndrome of children, MISC, presents about 2 to 4 weeks after the disease has gone away. That means you may have no symptoms or you may have a mild cold and cough. And that's what the dreaded multi-organ involvement is. Mainly it is cardiac, neurological. There is a lot of involvement of the lungs, of the kidneys, of the intestines. And the mortality of this is extremely high. It is treatable, but it is extremely high and very often with serious long-lasting consequences. So the only way to deal with a pandemic is not to let it allow to become endemic. To deal with the pandemic is to get rid of it by vaccination. And it has been proved worldwide. With regards to children, peculiarly, there is a lot of immunophenotyping difference in not only the body cells, but the response of the body in terms of CD4, CD8, immunoglobulin markers, and so on. Even the type of amino acid response which the body picks up in children is vastly different as compared to adults. We've seen children, especially during the Delta, present with a lot of non-pulmonary symptoms. So that is gastrointestinal symptoms, loose motions, vomiting, abdominal pain, rashes of various types. There are 5 different classifications of rashes which are seen. Eye involvement like conjunctivitis or even parotitis or even neurological complications. And the GI complications and all have been attributed to peculiar release of certain hormones like alarmin, secretin, zumulin, which cause what we call as an intestinal leak, which offsets the multi-inflammatory syndrome of children. So I think high index of suspicion, make sure that the children are vaccinated, make sure when the children are going out, even in a clean area, to wear a mask. Pediatric sizes masks is something which I've been advocating for a long time. Smaller children cannot wear adult size masks. Very often we have to adjust the sides as a double folding to make them fit well. But I think pediatric, like we have pediatric BP instruments and cuffs, we must have pediatric size masks of different sizes. And keeping a child well clean, well hydrated, avoid medication of unnecessary use at home, no WhatsApp university calls, no irrational use of antibiotics. It's extremely important. Over-the-counter antibiotics have done more harm to children than good. Do not use unnecessary pain-killing medicines or NSAIDs or anti-inflammatory medicines. A lot of them are anti-platelet, and in fact, they can destroy and upset the apple cart completely. So be careful, reach out to your doctor, look out for subtle signs, and if you are in the age group of 15 to 18, get your child vaccinated immediately.
Right. So, from what I get from your very detailed answer to this is that there are a lot of things that you need to look out for, and that is a question that only a trained pediatrician can answer. So make sure you're in touch with your your doctor, your pediatric doctor, whenever your child tests positive for COVID. And but again, at the same time, there is also a message out there to not panic and not over medicate yourself. So, Dr. Chugh, my question to you is that
with all humility and with the utmost love and affection for Dr. Krishan Chugh, I trained under him many decades back, and he taught me 2 things. Never forget to look into the child's eyes, because that's your insight into the brain. And never forget to look at the skin, because that's your external body cover for all internal organs. So examining the child is so important. Over to you, please.
Right, Dr. Chugh, would you like to go over a little bit about what are the absolute no-nos for a child who is probably suffering from mild COVID and they're being treated at home under their parents' supervision? What are the things that a parent should absolutely not do? Some of the things that you may have seen, in as Dr. Bagai said, in WhatsApp University.
So let's start with the medicines first, and then the non-medical totkas that people do. So medicine-wise, you see, these days when children are coming to us with a positive COVID report and they're having some symptoms, it is the symptoms that we treat. There is nothing that has to be targeted towards the virus in children. That means if child is having fever, yes, we will give paracetamol. If by chance the child is having vomiting, which is happening quite often in this Omicron wave, we'll give anti-vomiting medicine for a day or 2 maximum, and by then it settles down. An occasional one may have a diarrhea, loose motions, we'll give them ORS, or oral rehydration solution for that, and some of them will have, let's say, a little bit of cough. If the child is old enough, maybe a cough syrup. In the younger children, generally no cough syrup either. If they have a runny nose, yes, a medicine for that can be given. Beyond that, I have not prescribed anything till now to any child in this wave, at least. A lot of other things children do, parents want to do. They want to give a lot of steam to us. Yes, steam might help a little bit in the nose, but beyond that, we have seen more accidents occurring with hot water spilling onto somebody and child having burns rather than. So let's be careful if we have to, but I don't think it does wonders. So if you don't use steam, even that is okay. Giving any lozenges and all don't work, and they are not recommended. Then multivitamins and other vitamins, vitamin C and all, so many medications are being used. There is no evidence at all in medical science that any one of them works. No antibiotics, no ivermectin, no chloroquine, nothing of them is working. We started off in the first wave, okay, we didn't know much about it. Now that we know that these things don't work, we should not use them. Similarly, some special foods are being advocated that if you get this kind of food, that kind of food, nothing really. Just stick on to your usual fundamentals about food. That a balanced diet made in such a way that it is interesting for the young child, presented in a manner that children will like it. That's all that we are advocating diet-wise. Yes, adequate hydration is something that we should look for, we should do. Whether we want to give them just water or some juices or some hot liquids to drink, that's okay. That can be done according to the families on even traditions or their likes and dislikes of the child. Beyond that, I don't think anything really works, so we should avoid them.
Right. Thank you so much. Thank you for that clarity, because, I think we've been hearing a lot of this from, doctors across the country, that parents are so worried. They want to give something to their children, even if it's vitamins, just do something to help them. But as you said, there is very little that gets directed to the virus as such, and it's mostly treating the symptoms that works here. Abantika, I'm going to come back to the question of vaccines, and first of all, there are a lot of parents still hesitant because the data has not from the children's trials have not really been peer reviewed, and so a lot of curiosity, a lot of questions around how safe it is for them to take the vaccine. What do you think? Is it okay for them to go ahead with the vaccines despite the fact that the data has not been peer reviewed?
Yes, because the data actually has it has passed through all the levels of scrutiny that are there inside the government. And remember, so right now we are only using Covaxin. So if I only talk about Covaxin, then Covaxin cleared the subject expert committee review, I think way back in August or September, if I'm not mistaken. And after that, there was quite a long gap between that and the final approval by the Drug Controller of India. So due diligence was done in making that recommendation. Also, you have to understand that the subject expert committee actually said that it's okay to give this to children as young as 2 years. That was the data that Bharat presented. But we have started at a much older age group, 15 to 18 years. So I think yes, it would have been better, but I mean, it's a call parents will have to take. If you ask me if I would give it to my child, yes, I would. So I mean, that's the best reply I can give, because I cannot possibly ask anybody not to ask for evidence or not to ask questions. But I think this is something that will save the child. It's a pretty safe vaccine, Covaxin. That's one of the reasons why, remember, we have other vaccines approved. ZyCoV-D, for example, that's the world's first DNA vaccine. It's a very sort of fancy thing, but we are not going with it. It's got approval for 12 years onwards, but we are not going for it. And part of the reason is because Covaxin, this is one of the oldest vaccine technologies known. All of us are given polio vaccine. India has become polio free. So that it's the same technology, the inactivated virus, and safety is one of the reasons why we are going with Covaxin and not with ZyCoV-D.
Right. So what that means is basically that the academic peer review is an academic process. It's about publishing the results, but the regulatory process has been followed. India's regulatory authorities have actually approved the vaccine, so which is why it's rolled out. Otherwise, it did, like you mentioned, it did take a long time. Parents were quite eager, and that's what we see in the numbers as well. teens have come forward in huge numbers to get themselves vaccinated. I have a question from Shagnik Deb Shorkar, who is asking, should schools be opened for those students who are vaccinated? Dr. Sabai, if you would like to.
Okay. Sorry, so I think
Bagai, I'm sorry. I'm so sorry, Dr. Bagai.
that's okay. I think the data of for Covaxin in children has been submitted to the government. Yes, it's not in public knowledge as yet, but the data looks, what information we have looks almost the same in terms of vaccine efficacy, what we've achieved in adults. So it is safe. What is to reassure the public who's watching this program and all the people and parents who want the children vaccinated, that this is an inactivated whole viron vaccine. It is extremely safe. It contains no nanolipid particles. It contains no ingredients of the mRNAs, which very rarely cause anaphylaxis and other kinds of reactions, even though they are local. There is no real risk of death. So far, more than 4 million doses have been given worldwide to children. There has been no death which has been associated with regards to the vaccines, worldwide data. This is the Covaxin has no real risk of causing what we theoretically call as blood clots, what we call as thromboembolic phenomena. It doesn't precipitate what we call as the PF factor 4, initiates platelet destruction. It is not a risk for anaphylaxis or shock. This is not a risk of causing any myocarditis, pericarditis, or cardiac inflammation. But on the other hand, not to get a vaccine done, you are at 17 times more risk to get it from natural infection of COVID rather than the vaccine. So please get the vaccine done. But with regards the different types of vaccines, I'm sure we'll have more of them coming in. This is just a start, and we will have work our way down the age group wise also. But to answer your question was mentioning from the reader what?
Schools reopening. Should schools be reopened for those who have been vaccinated?
Yeah, so schools internationally have seen to be a hub of transmission. As I've mentioned, children are the silent super spreaders. Schools are classified as hubs. There are international studies to show that schools without vaccinations in school kids are 1.4 folds more at risk, and teachers are 1.6 fold more at increase. These are multinational trials data. And overall, unvaccinated between 12 to 18 are 11 times more at risk of getting infections from school. So schools, in terms of children being vaccinated, I think it's a must. The teachers must be fully vaccinated. The entire back office staff, the trainers, the helpers, the cleaners, the transport department, a lot of children come through school buses, all must be vaccinated. Two important points here. I think for a very long time, we in India have a very famous habit of converting a pre-existing real estate property as a building into anything which we want. So it can become a school, it can become a college, it can become a hospital, it can become a hotel. Hotels become hospitals, hospital becomes hotels. I think that's complete nonsense. What we really need is proper, appropriate, vertical-wise ventilation policies. I think ventilation is the new buzzword for the next many decades. It is not merely opening doors and windows. It's the positioning. It's the HVAC system. It's the number of air cycles which are cleaned per hour. It's the number of students per class. It is the positioning of the desks and the chairs in the class. It's the airflow currents which are seen. It's the sanitization for the air in the corridors. Toilets are a hidden source of transmitting SARS-CoV-2. We have to look at the exhaust facilities there, the air circulation there. And the second is mandating compulsory, mandatory masks. Masks are not a cloth mask. Masks are not a Mickey Mouse mask or a Superman mask. It has to be, especially for the Omicron, a high specification N95 well-fitting mask. It's absolutely important. If two people, even in a small room, wear a mask, a well-fitting mask, the risk of you even contacting remotely is 1 in 1,000. That's 0.001%, negligible. If one person doesn't wear a mask, 50% chance of getting it. If both don't get it, you just welcome COVID into your body. It's 100% risk. So it's distancing. I think schools have to go forward with full vaccination of the entire staff and the children who are attending. They have to go with proper ventilation policy. They have to go with proper masking policies. The school health units need a huge revamp. I think it's not just someone, I'm feeling sick, can I go and lie down in the medical room? No, I think you need a relook at the medical rooms and the facilities there. And last, most importantly, I think schools now are going to become the next hub of not only COVID, but a host of other infections. So we have to look at school because it's your second home for children. They spend 8 hours, 6 hours there. I think we need to look at that very, very attentively rather than dismissing it. Let's begin it only for academics.
Right, absolutely. Like again, we have had 2 years to work on this. I mean, schools have been closed for so long, and we going forward, we need to look at building an education system which is also complete in itself and can cater to things like these pandemics. I have a very detailed question from Venu Govindan, who's asking how many children have died from COVID in India since the start of the pandemic. I don't think that, what I instead of asking this, what I want to know from Dr. Chugh is that, have you, especially in your hospital, have you seen a lot of hospitalizations among children? Have they, has there been a high number of deaths even in the second wave? What were the kind of numbers you were saying? And to follow up with that is that if we know that the fatality ratio for children is very low, then why jab them? So
yes, the first part of it, how many patients have you seen getting admitted to the hospital? How many have come to the hospital for care and stayed there for a few hours gone? And how many ultimately, let's say, got admitted into an ICU? It's been a rare phenomenon. In the first wave, when it came, there was a lot of panic around, and there were some admissions made in the hospital because there were no great policies, and we were isolating just for sake of isolation. When the child was hardly having any symptoms, they stayed down in the hospital for 7 days, 10 days, because those were the kind of policies by the government agencies at that time. Quite unnecessary. We wanted to send them home earlier, but then there were other rules to be followed. Then there were a few in the first wave also who had comorbidities and serious comorbidities. And if they picked up the virus, 1 or 2 of them did come to the hospital and were in the ICU. Few of them were ventilated, and we lost 1 or 2 also. But those were very, very few numbers considering I'm talking about the whole of first wave, which lasted for several months. Then the second wave, when the numbers were much higher of patients at home, whether adults or children, but the numbers that required hospitalization were not very high. Again, most of them came for, let's say, a high fever and a vomiting. Now, when the child is vomiting, he can't take medicines. He goes into a kind of mild dehydration, and before that it gets too bad, we admit the child in the hospital for a day or 2, give anti-vomiting medicine, some intravenous fluids, and the child gets well and goes home. So that were the kind of patients. There were very, very few who came with what adults were experiencing, those pneumonias and low oxygen saturations and so on. Those are very few. And they also responded well to the treatment. Again, deaths were very rare. Hardly 1 or 2 deaths in the whole of second wave we saw in our hospital. And now the third wave, the Omicron. And Omicron, again, the admissions have been made for other reasons. When the child gets admitted to the hospital, like one got admitted just yesterday, he had a little bit of fever and thrown a convulsion. Now, any fever, a child of 1 year, 2 year can throw a convulsion. Child was admitted after having done a COVID rapid test and given the adequate treatment. Today morning, the sample that was taken yesterday night comes positive for RT-PCR. Now, that child has no other symptoms. It is by the way that we picked up the COVID, or the COVID had caused a little bit of fever, and the conversion was totally unrelated to, it could have happened with any other virus. So that kind of admissions, that kind of little bit of nausea, vomiting, maybe a very high fever. So those are the kind of admissions that we have had. There has not been even one who came with a pneumonia or a serious illness which has required, let's say, ICU care.
Right.
Now, if we say that these illnesses are not that severe, why jab? That is the kind of corollary to the answer that I've given. Dr. Bagai has already quite in detail told us why jab. These children, they are spreaders. We can't allow that. We want them to come out of the homes, in the parks, in the playgrounds, in the schools. That cannot happen unless we have vaccinated them, unless we are sure that whatever best possible we can do, we have done. And then he also pointed out that there is multisystemic inflammatory syndrome of childhood, MISC, that can happen some weeks after they have been exposed to the infection. Some of these children who suffer from MISC, they may not have had symptoms. And then a few weeks later, they come back. Somebody else in the family has had COVID, child was not tested, did not have symptoms, but a few weeks later, he comes with a cardiac problem related to COVID. So that kind of situations, we just cannot afford to see even one, because in that syndrome, there is a significant mortality. So there are very, very good reasons for us to vaccinate our children. And what we have started doing in the country is just the right approach. Start from the older age group, cover them up, and work your way downwards.
Right. Basically, so no child will be safe unless everyone is safe. So even if you think that your child does not have comorbidities or is at very low risk of severe disease, I mean, there is always a risk of MISC, and we don't know how that will affect probably another child or probably a close friend of your child. First question to Abantika before we wrap up. Lots of concerns about vaccine safety and data and all, but there is a way for parents to actually report adverse events, like if they are facing any problems after taking the vaccine. So can you quickly walk us through where and how parents can report these?
Yeah, so basically you have to report at the vaccination center or school or wherever you took the vaccine, because the system is for the vaccine, for the administrator there to upload it on the CoWIN website. Then it goes to the subcommittee, the local subcommittee, then to the district committee, and finally to the national level AE5 committee. So it's a long process because everything, they look at everything, if the child had comorbidities and what triggered the reaction, whether it was at all linked to the vaccine. All those things are examined. So after there's a lag basically in the AE5 report. So after all these considerations, the report comes out. But for an individual who wants to report, your CVC, which is your vaccination center, is where you have to go and report.
Right. And that, this whole process is intended to make sure that the vaccine is safe, and vaccinators have continuous data on how the vaccine program is affecting children and whether or not there are any serious effects of that. So this is something that parents need to be aware of, and you can, of course, report any adverse events to your vaccination center, as Abantika told us. That's all for today. Thank you so much. Thank you to all of our guests. This was actually a very informative session, and I hope our viewers also found the same. We will be back again tomorrow at 6 p.m. with another topic, a new set of experts to answer all your COVID-related questions. And we hope you liked our show. Do drop in more questions so that I can take them for the next episode. Good evening, and thank you so much.
Thank you.
Thank you.